Hello. Welcome to a brand new medical surgical lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes that accompany this lesson in your textbook in your notebook ready so that you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers RN nursing care for the eye and vision problems, including eyelid disorders, conjunctival disorders, corneal disorders, glaucoma, retinal disorders, and refractive eye disorders. By the end of this lesson, you should be able to understand that when caring for the patient with vision challenges, the nurse must pay special attention to the other senses, create an environment that is safe, and develop a method of communication that will be beneficial for the patient and the nurse. Know that it is important to review the pathophysiology of increased intraocular pressure and the negative results that consistent elevation can bring to a patient's well-being. You should be able to discuss the medical management of glaucoma and the surgical management of cataracts and other eye disorders. Let us do a quick overview of eyelid problems. And eyelid problems can be related to changes in the structure, in the function, or in the position of the eyelid, and may be impacted by aging. The first one I want to talk about is blepharitis. It is an inflammation of the eyelid edges, as you can see in this picture here. It most often occurs in the older adult and those with dry eye syndrome. It can be, of course, anterior edges, or it can be the posterior edges that are inflamed. There's decreased tear production that leads to bacterial infection and then itchy red burning eyes, and they may have some greasy scaling eyebrow of the eyebrows or the eyelid. Blepharitis is controlled with an eyelid care using a warm moist compress followed by gentle scrubbing with dilute, like a diluted baby shampoo is what usually would be recommended. Okay, if there's a bacterial infection, of course they're going to start antibiotics. The next thing I want to talk about is an ectropion. It's a turning inward of the eyelid, like you can see in this picture right here, causing the eyelashes to rub against the eye, causing them may cause some muscle spasms and scarring and deformity, or it may be caused from trauma as well. Patients report something in the eye. They may have pain and they may have tearing. There's a surgery that corrects the eyelid position by either tightening the orbital muscles or orbicular muscles, or they may have uh, do a surgical correction to prevent that inward turning of the eye. So the inward turning of the eye would be entropion. So the next picture I'm going to show is ectropion, which is the opposite of that. And then ectropion is the turning outward and sagging of the eyelid, as you can see in this picture right here. This often occurs with aging. It's caused by the relaxation of the orbicular muscles. It decreases the washing action of tears, and it leads to corneal drying and ulceration. With these patients, you want to go ahead and demonstrate how to use eye drops and how to apply eye ointment. There's a chart in your textbook that I've referenced in your notes that's going to be wonderful for that. Okay. Uh, the next condition I want to talk about is the hordeolum. It is an infection of the sweat glands in the eyelid where the eyelashes exit from the eyelid. It results in redness and swelling and tenderness, and the treatment includes the use of warm compresses, of course, and an antibacterial ointment is going to work too. Eclasion is an inflammation of the sebaceous glands, as you can see in that picture, in the eyelid, beginning with a redness and tenderness and followed by gradual painless swelling at the gland. Treatment includes the use of warm compresses, and you can use some eye ointment as well. And I have also referenced a chart that I want you to make sure that you look at, and it helps you understand the common drug therapy for eye inflammation and infection that is listed in your textbook, and it's referenced in your notes, and you need to be able to have a familiarity with the drug classes and the drug names and the nursing implications for each drug. Some of the problems in the lacrimal system arise from the reduced tear production, infection, or inflammation. So the first one I'm going to talk about is dry eye syndrome or keratoconjunctivitis sicca. It results from changes in tear production in the lacrimal duct or gland malfunction, and it alters tear distribution in the eye. As you can see, there's a lacrimal gland there, and there's a lacrimal ducts there. Okay. This can be an effect of drugs such as beta-adrenergic blockers or antihistamines or anticholinergics that cause tear production. It could be from diseases such as rheumatoid arthritis and leukemia, in sarcoidosis, and Sjögren's syndrome that causes decreased tear production. It could also be from an injury to cranial nerves, and or if a patient has had surgery, this can contribute to that as well. The nurse needs to be aware of what causes dry eye syndrome and be aware that the patient may experience that and intervene accordingly. Next, we're going to talk about conjunctival disorders. So the conjunctiva is a thin mucous membrane that covers and protects the eye, as we know. The first one we're going to talk about in this picture, as you can see, is conjunctival hemorrhage. The conjunctival blood vessels are fragile and they can break with increased intraocular pressure during sneezing, coughing, or vomiting, or with hypertension or trauma or any clotting disorders, and it may look pretty graphic and it may look pretty scary for the patient. The next one I want to talk about is conjunctivitis. Conjunctivitis is the inflammation that occurs from exposure to allergens or irritants, and it may be contagious and it may also not be contagious. Infectious conjunctivitis occurs with bacterial, viral, and infection that is contagious. So remember that the allergen and irritant exposure is not contagious. The viral, bacterial, infectious conjunctivitis, of course, is going to be infectious. So the focus of interventions is to prevent the spread of the disease to the other eye and to other people when we actually suspect that it is an infectious conjunctivitis. Okay. The next disorder I want to highlight is trachoma. Trachoma is a chronic bilateral scarring of the conjunctivitis caused by chlamydia and Chlamydia trachomatis, and it is a chief cause of preventable blindness in the world. So the textbook goes in more detail about trachoma. In this picture, you can see here the infection with chlamydia causes the inflammation of the conjunctiva of the upper eyelid, as you can see here. The repeated infections can lead to scarring and the contraction of the conjunctiva, which pulls the eyelid against the surface of the eye and it scars it. Over time, the eyelashes scratch the lens of the eye, and infection and scarring of the eye surface may follow, and then there may be damage in the eye surface, which with severe vision loss. This is something that is being treated worldwide, being a big problem and a number one cause of blindness, preventable blindness. Next, we'll quickly review corneal disorders. Corneal problems may be caused by irritation or infection with ulceration of the corneal surface. There may be degeneration of the cornea or deposits in the cornea itself. Corneal problems reduce the refractive power of the cornea and can lead to blindness as well. A corneal abrasion is a scrape or a scratch on the cornea that disrupts the integrity of the structure caused by a foreign body. It could be a trauma, as in this picture here. They've had to do a repair of the cornea. You can see the surgical sutures there. It may be from an inappropriate contact lens use, or bacteria, protozoa, and fungus can lead to corneal ulceration as well, which is a deeper disruption of the cornea epithelium extending to the stromal layer. The patient usually has pain, and they may have reduced vision, photophobia, and eye secretions. You want to stress the importance of applying the drug as prescribed even at night. The patient needs to be making sure that they're following the treatment plan. The next one I want to talk about is keratoconic cornea, or keratoconus. It is a degeneration of the corneal tissue resulting in abnormal corneal shape, as illustrated here in this picture. The corneal shape changes in it can occur with trauma, or it may occur as part of an inherited disorder. Treatment for permanent corneal disorder that obscures vision is aimed at restoring the corneal clarity and enhancing the patient's ability to see and to remain being able to have vision. In keratoplasty or a corneal transplant, it's the surgical removal of a diseased cornea tissue in replacement with tissue from a human donor. Somebody donates a cornea, and then that's what would be used for that. For a misshaped cornea that is still clear, surgical management involves a corneal implant that adjusts the shape of the cornea. The device is approved for this procedure is the intact corneal ring, and your textbook goes in more details about that corneal ring. You should be familiar with cataracts from your previous classes. A cataract is an opacity of the lens that requires surgery for correction when the vision is reduced to the extent that the activities of daily living are affected. The surgery should be performed as soon as possible. Most patients experience a dramatic improvement as early as the first day after surgery. You want to review the complications of a sharp, sudden pain in the eye, bleeding, or increased discharge. You want to review complications such as lid swelling, decreased vision, and flashes of light or floating shapes with the patient before they get to discharge. Your textbook goes in more details about cataracts. You should be familiar with glaucoma from your previous classes, but this is just a quick overview. This is a normal aqueous flow diagram that shows how the aqueous humor is going to travel through the trabecular meshwork. And glaucoma is a group of ocular diseases resulting from increased intraocular pressure. And I want to talk a little bit about the first kind, a primary open-angle glaucoma. Primary open-angle glaucoma is the most common form of primary glaucoma. It is usually bilateral and is asymptomatic in the early stages. And the other one I want to mention and review with you is the angle, excuse me, sorry about that. Lots going on. Angle closure glaucoma. Angle closure glaucoma, also called the close angle glaucoma, near angle glaucoma, or acute glaucoma, is less common and has a sudden onset and is an emergency. Okay, blindness from glaucoma can be prevented by early detection and lifelong treatment and a regimen of close monitoring and follow-up care with patients that have been diagnosed. You want to visual fields are measured to determine the extent of the peripheral vision loss. In primary open-angle glaucoma, the visual fields first show a small defect that gradually progresses to a larger field defect. Your visual field testing by perimetry is performed as is visualization, and they check the eye. The surgical procedure is a laser trabeculoplasty, and filtering. A microsurgery is used to when drugs for open-angle glaucoma are not as effective, and they may do a sclerectomy for glaucoma that involves removing a section of the sclera and the trabecular meshwork, along with a section of the canal schlemm to allow more direct drainage of the aqueous humor. There's other things that are discussed in your lesson as far as surgical treatment that are good for you to review. Okay, so now let's review vitreous humor hemorrhage. Vitreous hemorrhage may result from aging. It's a systemic diseases such as hypertension or diabetes mellitus or trauma. It may occur spontaneously. A vitreous humor hemorrhage may absorb slowly with no treatment or can lead to can be sealed with laser therapy or surgical removal of the vitreous. So there's a picture of what a vitreous humor hemorrhage would look like. Uveitis can be anterior or posterior, as illustrated in this picture here. Anterior uveitis is going to affect this area here, and the posterior is going to affect this area here. Of course, the intermediate uveitis is also going to be classified in the picture. Anterior uveitis is the inflammation of the iris, the inflammation of the ciliary body, or both, often following exposure to allergens, infectious agents, trauma, or systemic disease. The posterior is common term is also called retinitis, and the treatment for this includes resting the ciliary body with a cycloplegic agent. Remember, I told you to review those drugs that are listed so you're familiar which ones are cycloplegic agents. Let's now quickly review retinal disorders that can cause progressive degeneration and lead to blindness. The first one I want to review is macular degeneration. Macular degeneration is the deterioration of the macular, the area of central vision, and can be age-related or can be exudative. So the treatment aims to help the patient to maximize the remaining vision, to maintain the ability to read and write, and to recognize safety hazards, and be able to drive. Dry age-related macular degeneration has no cure. Management of dry age-related macular degeneration is going to be focused on slowing the progression of vision loss and helping to maximize the remaining vision. There are recent clinical trials with agents to slow the progression of macular degeneration. It talks about new blood vessel formation and the vascular endothelial growth factor inhibitors, which are a new class of drugs, have shown to success in the management of wet macular degeneration. So wet macular degeneration and dry macular degeneration. If you're not familiar with those, please review your notes and your textbook to be able to tell the difference between those. The next one I want to talk about is going to be like a retinal hole or retina tear. A retinal hole is a break in the retina caused by trauma or aging. A retinal tear, as you can see in this picture here, retinal tear is a more jagged and irregularly shaped break resulting from traction, and a retinal detachment is a separation of the retina from the epithelium in the eye. Treatment involves creating an inflammatory response to bind the retina and the choroid together again around the break, and using cryotherapy or photocoagulation or diathermy. Okay, the next retinal disorder I want to talk about is retinitis pigmentosa. It is a condition. Retinitis pigmentosa is a condition in which your retinal nerve cells degenerate. There's a picture there that's the normal retina, and then you can see the retinitis pigmentosa in that picture. This is a very quick overview of refractive errors. The ability of the eye to focus on image on the retina depends on the length of the eye from the front to back and the refractive power of the lens. Refractive errors are caused by problems in either length or refraction. So when I talk about hyperopia, which is farsightedness, presbyopia, which is age-related changes when lens lose their elasticity and they cannot focus on close things. And astigmatism is when the curve of the cornea is uneven. So these are the conditions that you may hear that the patient is diagnosed with. Trauma to the eye or the orbitals can happen with almost any activity. Hyphema is a hemorrhage in the anterior chamber from the force applied to the eye, which breaks the blood vessels inside there. The patient with hyphema is treated by bed rest in a semi-phallus position to use gravity as an aid in keeping that away from the optical center of the cornea. A contusion of the eyeball is caused by traumatic contact with a blunt object, and periorbital ecchymosis, or a black eye, as in this picture, is a common contusion injury, and it usually caused by blunt force trauma and results in bleeding into the soft tissues. Lacerations are wounds caused by sharp objects and projectiles, and the most important thing to remember as a nurse here is never to remove a protruding object from the eyeball, because it may be holding eye structures in place and it has to be surgically removed. So if you are responding to an eye trauma, remember not to remove any protruding objects in the eye. The patient with a penetrating eye injury has the poorest chance of retaining vision in the eye, and we want to make sure that we get them to help as soon as possible. Now let's talk about ocular melanoma. Melanoma is the most common malignant eye tumor in adults, occurring most often in the uveal tract among people that are 30s and their 40s and associated with exposure to UV light. Enucleation or surgical removal of the entire eyeball is the most common surgery for ocular melanoma. Let us now summarize some general concepts that we need to remember when caring for patients with reduced vision. You want to ask the patient about their vision problems in any other family members because many vision problems may have a genetic component. Different forms of reduced vision may affect any or all aspects of vision, including color, light, image, movement, and acuity. You want to orient the patient with reduced vision to his or her surroundings in the hospital. You want to include how to call for help and where the bathroom is located. You want to identify the patient identify the room of the patient and reduce vision without identifying the patient. You want to knock on the door before entering the room of a patient with reduced vision and introduce yourself. You want to use a normal tone of voice to talk to people who have reduced vision. You do not need to yell at them. They have normal hearing. You want to identify at-risk patients for any visual impairments as a result of work and different things. You want to encourage all adult patients older than 40 to make sure that they get an eye exam and they measure intraocular pressure every year. You want to encourage all to use a polarizing sunglasses whenever you're outdoors in the bright sunlight. You want to encourage all patients to wear eye protection if they're performing work that's going to put them in danger. You want to teach all patients to wash their hands before and after touching parts of their eyes. Avoid performing any ophthalmoscopic. I can't say this word today. Ophthalmoscopic. Avoid using an ophthalmoscope on a patient that's confused. That's better. You want to refer patients with visual impairment to their local resources and support groups. You want to teach patients proper techniques for self installation of eye drops and eye ointment. I have included references on that information in your notes. You want to stress the importance of completing an antibiotic regimen if somebody has eye infections. You want to make sure that the patient at risk for increased intraocular pressure knows what activities they need to avoid. You want to teach patients with infections not to rub their eyes and infect the other eye, and you want to allow patients and family members the opportunity to express their concerns. Thank you for listening in to this lesson. I hope you have enjoyed this review of the RN nursing care for eye and vision problems. And we've included information on eyelid disorders, conjunctival disorders, corneal disorders, glaucoma, retinal disorders, and refractive eye disorders. If you have any questions about this lesson or any of the corresponding notes, please feel free to email me. Have a lovely day.